Royal Wound X proudly presents a guide for the application of Amnio-Maxx. Product Overview. Amnio-Maxx dual-layer amnion patch is an allograft derived from donated human birth tissue and sterilized using radiation. This patch is provided in a dry form and is designed to act as a barrier, offering protective coverage for both acute and chronic wounds. Amnio-Maxx dual-layer amnion patch can be applied from the onset of a wound and throughout its healing process, with reapplications either weekly or as recommended by a healthcare practitioner. Until use, Amnio-Maxx should be stored at room temperature or 59 to 86 degrees Fahrenheit. Amnio-Maxx has a 5-year shelf life. Preparing the wound. Before applying the graft, ensure the wound is free of fibrotic, necrotic, and devitalized tissue. Wound bed preparation should be performed according to standard wound care protocols. Use a scalpel or curette to excise the wound margins, saucerize the tissue, and debride the wound bed. The objective is to create a healthy, bleeding, granular wound. Cleansing the wound and peri-wound tissues should be performed with sterile water or sterile saline. Be sure to control bleeding prior to application. Preparing the implant. Once the wound bed preparation is complete, open the carton and remove the outer tray containing the product. It is important to note that the outer tray is not sterile and should not be placed directly onto a sterile field. Peel open the outer tray and remove the inner tray using aseptic technique. The inner tray is sterile and may be placed onto a sterile field. Open the inner tray using aseptic technique. Peel the tray open and aseptically remove the package containing the allograft. Using scissors, cut open the package. The dry graft needs to be hydrated. Amnio-Maxx dual-layer amnion patch can be soaked in sterile saline for approximately 60 seconds or rehydrated with a saline bullet once applied to the wound bed. If using a saline soak, remove the Amnio-Maxx dual-layer amnion patch from the saline and apply to the area of interest. The Amnio-Maxx dual-layer amnion patch does not have sidedness, and either side can be placed onto the wound bed. It should be noted that the appropriate graft size should be selected based on the post-debridement wound measurements in order to provide complete coverage to the wound bed while limiting the amount of product wastage. Securing the implant and post-application. The Amnio-Maxx dual-layer amnion patch can be secured in place using steri-strips, sutures, or staples. After Amnio-Maxx application, cover the wound with a non-adherent contact layer to protect the graft, followed by an exudate-managing secondary dressing. After use, handle and dispose of all unused product and packaging in accordance with accepted medical practice and any applicable local, state, and federal laws and regulations. Please note, once the container seal has been compromised, the allograft must be either transplanted, if appropriate, or discarded. The Amnio-Maxx dual-layer amnion patch can be applied weekly until the wound closure is achieved. In most instances, the patch will be completely absorbed and therefore does not need to be removed before reapplication. Repeat the pre-application, application, and post-application steps with each new application. Royal Wound X, your partners in advanced wound care solutions.